Coronary artery bypass grafting, or CABG, can be remembered by the last cabbage on Earth running for his life. This is an invasive surgery in which a blood vessel is removed or redirected from one area of the body and placed around the area of narrowing to bypass the blockages and restore blood flow to the heart. Indications for this procedure include individuals with ST segment elevation myocardial infarction, or STEMI, shown by elevated street and Mayo heart infarction FART. Although not a cure, CABG is considered palliative treatment for patients with cardiovascular disease, shown by the heart diseased. This procedure may also be used to treat uncontrolled angina not responsive to medical therapy, represented by the uncontrolled angel. The internal mammary artery is the preferred artery for CABG, shown by the milk bottle and artery archer. The saphenous leg vein may also be used, shown by the sapphire vine. CABG procedures involving this vein may result in transient limb edema for 4 to 6 weeks after the procedure. Transient limb edema is shown by the transient bum limb edemame. Following surgery, closely monitor patients, shown by the monitor close to the patient. This includes assessing for signs and symptoms of bleeding and fluid and hemodynamic values. Like with many surgical procedures, venous thromboembolism prophylaxis should be initiated, shown by the Vine's trombone Elmo with purple axis, and the patient should be encouraged to use an incentive spirometer, shown literally, as this helps prevent post-operative complications. So let's review coronary artery bypass grafting, or CABG. It is indicated for patients with ST segment elevation myocardial infarction, cardiovascular disease, and uncontrolled angina. Vessels used during CABG most commonly include the internal mammary artery, but the saphenous leg vein may also be used, which can lead to transient limb edema. Closely monitor the patient following the procedure and initiate venous thromboembolism prophylaxis, and encourage use of an incentive spirometer.
In a world without food resources, one cabbage stands between what's left of humanity and the apocalypse. And everyone is dying to have a piece. Food is scarce, and cabbage is the last of his kind. He runs for his life from those who try their hardest to catch him, wielding a scalpel and donning a surgeon's mask. And once Hart takes a bite, chaos is unleashed. From up on top of the elevated street, Mayo Heart bites a chunk out of cabbage and instantly regrets his decision as he lets out a huge fart. After all this time, the cabbage has gone bad, so Hart becomes diseased and dies. Up in heaven, Hart is now an uncontrolled angel. Filled with rage, the angel lifts up the elevated street even higher, revealing a seedy post-apocalyptic world, where those who are lucky enough to find old milk bottles get them stolen away by Artery Archer. People try to barter for food, but not even the most priceless sapphire vine can pay for anything these days. Like the transient bum with edamame, he begged the archer to take the jewel instead of his last meal. But in this world, food is the only thing worth fighting for. So much so that people are starting to look tasty as Monitor begins to try to eat the patients. Then they set up booby traps and vines to catch trombone Elmos that luckily cut themselves out with purple axes. And he's so hungry that he tries to eat his spirometer. If only they had a cabbage.